A lot of these communities here, they don't get a lot of care that they need. They don't have access to care.
There's so many people out there without insurance that can't afford them, and they need help.
There's a lot of people that's suffering because they can't afford to go to a doctor because they can't afford the insurance.
Without this sort of an event, they wouldn't get the help.
You can't put a price tag on what we're doing in these clinics and the care we're giving and the impact it has on people's lives.
Remote Medical is it's a nonprofit. We travel around and we set up mobile medical clinics. We do these around the country from coast to coast, and we provide all the services at free of cost to the patients that are coming through the doors.
Originally, of course, Remote Area Medical was organized for the purpose of going to third world countries. I found myself in a place in South America called British Guiana, and I was very badly injured. They pulled me out from underneath the horse, and one of them said, well, the nearest doctor is 26 days on foot from here. And so that was really the beginning. Eventually learned to fly an airplane. I was able to fly in medical supplies. Came to the conclusion that maybe we needed to bring the doctors a little bit closer than 26 days on foot. Years later, ended up here in the United States. And to my surprise, I found that there were millions of people that didn't have access to the health care that they needed.
RAM is important because it fills a gap. The need for health care is out there across America, whether you're in Appalachia or whether you're in Los Angeles. We see the same thing from community to community.
We brought it to the community knowing there was a need, but not having any idea how great the need was. It wasn't a question as to whether or not we would bring it back.
These clinics are designed for locals to come through the community. They're able to receive medical, dental, or vision care.
Even though many of them are working, many of them have health insurance, that's an area that's not covered by insurance for many, many policies.
This is wonderful. I mean, to have something like this to provide the health care that people need to prevent tooth loss, to prevent breast cancer.
Free health care, totally free, no questions asked.
It's really going to change their lives, and it's going to change their lives in a good way for a long time.
RAM is an opportunity for someone to give back and to take part.
I was so impressed with the first clinic that I went to. I came back a renewed person. I would strongly encourage all medical professionals to consider volunteering. Here you're free to provide medicine and give the very best care you possibly can to people who truly need it.
Even if you have no medical experience, you can come into a medical clinic and provide a service that really touches the lives of people.
What we do, of course, is a very expensive operation. Our support comes mainly from those $10 and $15 donations from the general public.
To get involved, it's actually through our website at ramusa.org. Someone can sign up as a volunteer. Again, they do not need any medical experience.
It's a real privilege to work with Remote Area Medical.
I'd like to invite you to volunteer at future clinics and fund future efforts by going to ramusa.org so together we can make an impact in our communities. And thank you again.